So you've probably heard about behaviour questions or questions where they ask you for an example in the interview. And you've probably heard about the STAR framework for answering these questions. Today in this video, I'd like to give you a few advanced tips on how to answer behavioural questions, starting right now in this video. Hello YouTube, I'm Anthony, I'm the career doctor. I'm here to help you manage your medical career. Today we're going to talk about the behavioural question in the interview. It's a real favourite for interview panels. They often ask more than one, maybe two or three out of the 6 odd questions that you might get in a medical job interview. And the reason is pretty clear. There's a reasonable amount of evidence to back up the idea that if you ask someone for an example of a past behaviour, they're more likely to be able to relate a competency in terms of something they've done and demonstrated before, which has a little bit more value in terms of the employment decision because it's based on the principle of past behaviour will predict future behaviour. So there's a very common framework that everyone uses to encourage job candidates to answer these sort of questions. It's called the STAR framework: situation, task, action, result. Sometimes you hear it in the CAR, context, action, result. It's well known. It's a good framework for both providing the example in interview as well as actually addressing selection criteria when you put your job application in. And I've talked a lot about that already in some of my videos, but today I want to give you some advanced techniques around STAR, a few extra things that might help you to stand out. So let's just get into a little example. So an example question I've been using in some of my workshops is this one. This would be a very common one that's asked probably for even a resident job, maybe even a registrar job, even a consultant job. This is kind of an insightful question. Can you give the panel an example of a recent bad day that you had at work? Now that's, on the surface a bit of a challenging one, isn't it? Because, what does a bad day mean? It could be a bad day that you personally had or a bad day because of the circumstances at work. And it might throw you back. So if you kind of haven't got an example for that, you could be a bit thrown and have to think for a bit. But this is probably a scenario where you could have an example of something that didn't go well that you could use as an example of a bad day. So the example we came up with in response to this particular question, assuming it was for more of a resident job, was this one. So the example is about working in an emergency department on a busy night where you as a resident were overwhelmed by a lot of patients. The registrar was distracted doing some of the important stuff in the ED, like looking after trauma patients. And unfortunately, the intern that you were working with wasn't performing up to scratch. And so you were feeling a bit stressed and had to think about how you were going to deal with it. So here's how that might be described using the STAR technique. So the situation occurred recently when I was working as a resident in my emergency term. One evening, it was quite busy and there was myself, another intern and a registrar who got caught up with a trauma patient. So there's the situation. You're on ED, you're with 2 other doctors, one of whom, your senior, was caught up busy doing something very important. So what we're trying to do with these STAR examples and what we try and do in the interview generally is paint a bit of a picture of what the situation was for the interview panel. So trying to get them to put their mind in the scenario and visualize themselves as you're describing this sort of example. And that can be powerful on a couple of lengths. It's always good to attach a story to you, and it might get them thinking about you working as a member of their team and getting them what we call future focused in terms of visualizing you working with them and getting comfortable with that concept. So we then go on to describe the task. So my task was to help my registrar out by keeping the rest of the department moving because the registrar was busy doing something else. And about halfway through the shifts, things were getting pressured, and I sensed that a lot of people were getting tense and upset, particularly the nursing staff and the patients and families who were waiting to see a doctor. So it was getting quite busy. Again, you're painting that picture. To compound matters, I felt that my fellow intern was really slowing us down. He was taking a long time to get through the patients, even though they were simple ones that we were allocating to him. So then we describe what the actions were that we took in that scenario. So my only option at the time was to keep going and see as many patients as I could. Eventually the registrar became freed up and we managed to clear the backlog. But I was ending up the shift feeling annoyed because I felt that the intern really hadn't appreciated that situation. So I felt I should take action and have a conversation with them. And so this is a good thing, that you're telling the panel that you don't leave difficult conversations unconversed, that you're you actually recognise it's important to have conversations when you're feeling like something needs addressing in the hospital rather than letting things fester. Breaking from that though, one thing I think it's important when you're describing any sort of communication example or approach to communication in the interview, is that this is an error I see quite a bit, is avoid the tendency to say something like, I went and had a coffee with them. Or it seems to be a common thing that comes up that when you want to have a chat with someone in a hospital, you go to the cafeteria and have a coffee with them. Now, why would that be a bad idea in these sort of scenarios? Well, there might be something private or distressing that comes up. You don't want to be having a conversation in public where other people might be observing them. Think about the privacy of the other individuals that you're involved with and the respect that you need to demonstrate when you're having potentially a difficult conversation with someone else. So it's really important to talk about how you would have your conversation, or how you did have the conversation, to display those sort of high-level communication skills. So in this case, I asked my colleague if they had noticed how busy it was last evening, and I was relieved to find out that they had. They appeared a bit defensive, but before I could ask another question, they apologised for being slow. They seemed upset, and so given it was late, we agreed to meet the next day before work to have another chat. The next day we met in one of the emergency department offices, so respecting privacy. And again here you could also go on to talk about the approach to having the conversation. It turned out that they were quite nervous about working in the emergency department and scared about having to review patients with the registrar each time in case they got something wrong. So this is a common thing for particularly new interns. So we agreed that they would come to me first to do a practice run before talking to the registrar. And now we encapsulate this example with the result. And this is important because I see a lot of the time in the interview that candidates are really good at giving me the situation, the task, and the actions they took, but they can't tell me about the outcomes. And if you can't do that, you really haven't sold the example to the panel, and you're going to do yourself a disservice. So the result was an immediate improvement in my colleagues' performance that evening. They were much quicker in seeing patients, and after running them by me, had the confidence they needed to talk to the registrar about it. Pretty good result in that scenario, and that's what you're kind of looking for in an example when people are asking for an example in an interview. So that's a pretty good start technique and start example to give to the interview panel. But how could we make it a little bit better? How could we show ourselves an even better candidate to the panel based on our past experience and the sort of things that we can do and would do in the future? Well, we can do some different things with the STAR technique, and sometimes actually it's quite hard for people to think about the concrete result. In that past example, we had a pretty definite result in terms of improved performance, but often, particularly with these sort of communication challenges or errors or whatever, it's hard for you to go back and say things were definitely improved in the system or with other people for next time. But we can also look internal to ourselves and show that we've reflected on the example and how we would do things differently next time. So sometimes you can turn the result into more of a result by reflection. So what would that look like in this scenario? Well, you might say a couple of other things to the panel. The key thing I learned from this encounter was to try to not let your feelings and emotions cloud your approach to dealing with a difficult issue. I think achieving a result like this would have been much harder if I'd been more matter of fact. So not listening and trying to hear from your colleague in that scenario and assuming that maybe something had been missed for them rather than that they were actually just deliberately trying to create problems for you. If I was to have the situation again, I would probably have chosen to wait till the next day to speak to my colleague. That kind of seems obvious, doesn't it now? I mean, you're kind of torn between the need to kind of nip things in the bud and address them immediately versus, well, we've just done a busy night shift, maybe this could wait for a conversation the following day. So there's a couple of reflections that you could throw in using that example, and it's often good with any scenario, even if you've got a result, to talk to the panel about what you learnt from that experience and how it's helped in your growth as a doctor. So that's one thing that you could do to really sell your example. But another thing that you might think about here is that often we are dealing in hospitals with very complex situations, and we're looking for people and doctors who can handle complexity and work within that sort of framework. So sometimes it's good to give the panel an idea of the difficulties and the complexities that you were dealing with at the time, to sort of sell it as a difficult example that you had to deal with and dealt with successfully. So sometimes we can flip the task out and use complexity, so the SCAR approach, another kind of easy mnemonic to remember. So what might that look like in this particular scenario? So we might actually just upsell or talk a little bit more about the complexity rather than sort of brushing past that too much and getting to the result. So we might say something like, it was a complex situation. Always good to signpost things here. I was helping my registrar, but it was not a normal night. The department was about 50% busier than most other nights, and my registrar was forced to spend half their shift sorting out a complex trauma patient. As I recall, there were also 3 suspected myocardial infarctions and several possible fracture patients, so giving them like an idea of how busy it was and painting that picture for them. And then to compound matters, I felt my fellow intern was really slowing us down. It was taking a long time to get through the patients. I had also not had a chance to get to know them. So you not knowing person is part of the complexity picture here in terms of understanding where they were coming from. So that all helps to paint to the panel the idea of a very busy emergency department where lots of things are going on and you're dealing with lots of different things at the time and having to make quick decisions, as well as dealing with this particular scenario and having to resolve it in your own mind. And of course, we can actually blend these things together as well. You don't have to just stick with STAR or SCAR or only give the result or only reflect on things. You can give the whole bunch to the panel if you really want to, and that will help to really give some character and context to the scenario and give even better picture of how you as a doctor can resolve complex situations in the hospital or the health service that you work in. So there's a couple of advanced techniques for STAR or advanced techniques for answering a behavioural question in the interview. If you'd like to find out more ways of improving your interview performance, then I do have coaching available and also an interview skills course where we talk a little bit more about the STAR technique and hypothetical questions. And I even show you how to align the STAR technique with the competencies that you need to demonstrate in the interview to make it clear to the panel that you are the best candidate for the job. A reminder that we've got our workshop on the 29th of June in Sydney, and we'd love to see you there. If you've got any questions or comments about this particular video, leave them in the description below. If you're liking these videos, leave us a like. If you've watched more than one, then please subscribe and turn on notifications, and I will see you in the next video.